This debate fundamentally is about giving kids the best start in life and giving mums the best care that they need. And I think there can be few subjects which should be of more importance to us right across the House. Within that, though, the evidence is clear that midwife-led maternity units are great for babies and for mums. They are every single bit as safe as those big hospitals that we've heard many members talking about today. But one of the real benefits that they offer is the option of a more natural birth with less intervention from health professionals unless it is necessary. If a mum delivers at a midwife-led unit, they are less likely to need a caesarean or help from forceps or a vacuum. And while those procedures can be life-saving, and we should thank the people who are using them every single day for supporting those babies and coming into the world, those types of procedures do come with downsides. Caesareans increase the risk for mums, including hemorrhage, blood clots, infections in the womb, and they take much longer to recover from. The potential side effects of having to use forceps and vacuums are less severe, but are nonetheless very real and very present and very there. And as the previous member said, choice for mums is really important, and making sure that people, when they're coming to the end of their pregnancy, they have a choice of where they want to go to be able to deliver, be that at home, be that in a more clinical setting if there's additional risks, or be that in a midwife-led unit, is something that we should all support so that people have the option to have the birth that they want. In Lichfield, we were lucky enough to have a fantastic midwife-led maternity unit at Samuel Johnson Community Hospital. This was closed down during the pandemic for reasons that I think we would all understand given the national crisis that we were going through, but it has never reopened. The closest maternity unit is at Queen's Hospital in Burton, which is 11 miles up the A38, which, when HS2 isn't destroying the transport infrastructure in my constituency, isn't necessarily a significant a trip in an ambulance or something along those lines. It does present barriers to people who maybe don't have access to their own transport. As we currently now stand, that will be the only option available to people in Lichfield. Mums in Lichfield will very soon not have the opportunity to choose that midwife-led unit because it is on the chopping block. That would be a huge loss. This service gave women in Lichfield, Burntwood and the surrounding villages somewhere closer to home to deliver in a calmer, quieter setting than in that big hospital. Where that was appropriate, that's something that I think everybody in this room, and I would assume many people much more widely, would want to support. Shutting that would mean less choice for mums and potentially worse outcomes for mums and for babies. And I've met so many people whose children were born at that unit who are so very happy to have had that option. And one of my staff, when I mentioned that I was taking part in this debate, without prompting, just jumped straight in. She said she'd had 4 kids, 2 in a very big hospital in that kind of clinical setting and 2 at the Samuel Johnson. And she was so much happier with the experience that she had in the midwife-led unit. She wasn't talking down what happened in the other hospital at all, but that more natural, quieter, more relaxed environment was so much of a benefit to her as she was going through childbirth. And I did want to put on record my thanks to everybody who works in the maternity services, but also particularly to those people who want to champion midwife-led units.